CUES is the first commissioned service to go live within Hillingdon, and so it represents a major advancement in community eye care for our practices and primary care optometrists. With the inclusion of IP provision and OCT, CUES allows us to manage more severe eye conditions, broadening the scope of eye care for our communities. That primary care optometry has an integral and important role in reducing the burden on an already stretched secondary care.
As a previous METS practitioner, we'd got used to in our practice only being able to see patients within a certain CCG. The nice thing about CUES is that with all our surrounding CCGs having taken part, now it's not the patient's postcode that depends on what care we give them. It's been really useful with the Opera platform to be able to look up a patient, check that their CCG covers the CUES, and then get all their details on Opera. With given consent, being able to access the shared care record and be able to view their medication when the patient usually doesn't know what they're taking has been really helpful.
First patient I saw, who was self-referred, but soon we were seeing patients being referred by the GP, also by 111, along with pharmacy, and even patients who just rang up for some advice. Local pharmacies have been quite happy to get involved, and I managed to gather a collection of email addresses so that we can either send written orders over to them directly that way, or we can actually direct patients to them for different things that they can be supplied with.
The network of practices working in the way that CUES works has really embedded into practice relationships and working together as a team, as an optical profession, rather than at individual silos. And obviously the other impact of CUES is the accessibility of patients to urgent eye care, and the also with referral is then required to the hospital eye service, ensuring that the patient goes to the right place first time, and with the transfer of OCTs enabling one-stop care for people with wet AMD, or even feedback to that actually referral and treatment's not appropriate for that patient, and saving a hospital appointment. So all in all, we've found the service has been really successful in a number of ways, both the hospital, the patients and community optometry.
One thing I'm particularly excited about is the advice and guidance facility. So I see that's a real thing for the future, where there are many occasions in practice you're not exactly sure how to handle something. Do you refer it? Do you hold on to it? And I think the ability to transfer a file with some case notes to a colleague in the hospital eye service, and then to get back to you with it, I think you should do this. I think that will help our optometry colleagues immensely in the future.
When in March the COVID crisis hit, our local eye unit were fortunate to have the foresight to share their resilience plan and provide FP10s for our IP optometrists. When LOCSU published the CUES model in April, it captured and brought together a number of best practices from around the country. It recognised the investment and the value of independent prescribing and OCT at the practice level. Although we have care navigation pathways in Herefordshire, we do need to do more to publicise the service so we can further educate the public, the GPs and the pharmacy to streamline and appropriately direct people to services. Our local eye unit has even taken an approach of calling all the local practices each day to identify their CUES capacity